All right, everyone. Assalamu alaikum. It's me, Quratulain, a clinical psychologist and interpersonal therapist from Pakistan. First of all, very congratulations and most welcome to this certified training course. Here, today, it's going to be our first lecture. So, we will be starting from understanding the psychopathology or the framework of the psychopathology, first of all. When we are talking about the psychopathology, the first thing comes into our mind is the psychological issues or the disturbances related to the psychological manifestations or the problems, right? So, every kind of psychological problems or the psychopathology have certain diagnosis when it becomes disorder. When a psychological disturbance create a significant change, or you can say a significant disturbance in the individual's personal life, including the social and personal daily living skills and all that, then it's called as a disorder. And that disorder needs a certain diagnosis, right? So every problem, when appears to be a disorder, and later when that particular problem manifests itself, or you can say a psychological problem reaches to the point where it actually tries to show itself or tries to appear in your behavior, then we call it as a psychological manifestations. Okay, so, the psychological manifestations are normally dealt with the psychopharmacology, or you can say the medications or the certain legal drugs, including anxiolytics, antihistamines, antidepressants, and all that. We normally have listened all about it, right? So today we are going to start learning certain scenarios of the psychological disturbances as per the requirement of the course, and we will be understanding what actually the psychopathology is, what is the framework of the psychopathology, what actually psychopathology is called about. All right, so as we have talked about the overview of the diagnosis, or you can say the course of this outline, we will be studying the diagnosis of certain problems. We will be studying the psychological manifestations. We will be going through the psychopharmacology and the significant or the primary treatment plans regarding certain psychological problems. Then it comes to what actually psychopathology is. What is the diagnosis of psychopathology? When we are talking about the psychopathology diagnosis, it means the process of identifying, clearly distinguishing the mental disorders based on the established or the certified clinical criteria and the clinical assessment. Being a psychologist, or there are certain psychiatrists, they have to follow a certain manual. In our language, it is called the Diagnostic and Statistical Manual, right? So that is the DSM, and now we have a DSM-5 TR, right? Same like that, psychiatrists have their personal manual that is called the ICD, right? So psychopathology diagnosis is actually clearly identifying the mental disorders based on the written or ideal criteria in the DSM-5 TR, okay, and your personal assessment as well. Each and every time when we state a clinical assessment, it actually means your cultural approach, your personal and your cultural approach. There are certain disorders like the autism, like depression, which actually create a very different manifestation or have a very different physiological appearance in case of Pakistan, in case of any US based country, because of our cultural differences, because of our belief differences. All right. So we will be exploring the diverse emotional, behavioral, and cognitive symptoms associated with psychopathology. when we are basically talking about the psychopathology, psychology is actually comprised of these three, you can say, the pillars. It's your emotion, it's your behavior, and then it's come to your cognition or your thoughts. Any kind of psychological problem is actually might be associated to these three pillars. If it is about the cognition, then it's about your thoughts, like depression. It's all about your thoughts. Okay. Then, due to the depression, as we all know, our emotional cycle got disturbed. We get devastated. We feel depressed. We feel low. That is because of our emotional pillar, right? And when it comes to our behavior, then we are actually performing low. We get irritated. We are feeling agitated sometimes. We start crying and all that. That is your behavioral manifestation associated to your psychopathology or an individual's disturbances, right? So here comes that why we include the psychopharmacology when we are talking about the psychological problems and their treatment. Basically, if a problem is about psychiatric or psychological disturbances, then you have to understand that first of all, the medication is important to actually regulate the emotional and neurotransmitter level. All right. So psychopharmacology is basically the study of how medication can be used to manage and alleviate the psychiatric symptoms. Sometimes there are certain neurotransmitters in our body, which actually, when their ratio gets low in our body, then we would be like having a psychotic episode, right? We would be having hallucinations or something like that. Then it can have an example of dopamine. If we have lack of dopamine or a deficiency of dopamine in our body, then we will be having Parkinsonism. And if a person is having an excess of dopamine in his body, in any case, due to any reason, then a person will be presenting some kind of psychotic episode, like hallucinations, like triggers, like something like that, right? And a very devastating delusion sometimes as well. So basically, psychopharmacology is related to regulating that kind of neurotransmitters or chemicals in the individual body to manage those psychiatric symptoms, right? So when we are talking about the treatment, basically, more often, we are actually talking about the psychotherapy, right? Most probably, we are used to listen this kind of words sometimes. Any kind of treatment in psychology is most commonly called as psychotherapy, but basically, it's a very narrated term in this regard. All right. So basically, the treatment of any kind of psychopathology comprises of the psychotherapy, medication, and holistic intervention, or you can say the individualized treatment plan. So here comes what kind of disorders we have to normally deal in kind of psychopathology in terms of psychopathology. Then normally it's about a certain group of disorders. For example, majorly anxiety disorders, right? It's not just a single disorder. I'm talking about a group of disorders right here. Okay? Anxiety can be of different types, right? So basically, anxiety, it we actually will learn about maximum anxiety disorders later when we will be having lecture on the anxiety disorders separately. But right now, we are discussing about the group of major groups of the psychopathology here. So basically, in the anxiety disorders, the characteristic features and treatments for the anxiety related conditions are very different as compared to any other disorder. It always depend on your stress. It always depend on your stimulus. It always depend on certain kind of manifestation. All right. So as we have talked earlier, your psychotherapy, your medication, and your holistic approach is actually the treatment or the overall framework of your treatment plan. So in case of anxiety disorders, we normally have included the anxiety disorder itself, obsessive compulsive disorder, and certain kinds of phobias. So the second group of or a bunch of disorders are basically the mood disorders. Mood disorders are basically when we are talking about mood disorders, they are basically around the continuum. At one continuum, we are actually talking about the depressed mood disorders related to the depression. And at the other continuum, we are talking about the mood disorder related to the extremes. Okay, so at this continuum, when we are talking about the extreme moods, we are actually talking about the mania. We are actually talking about the bipolar disorder with the manic episode. We are actually talking about the mood disorders or a bunch of disorders which actually have a very sensitive ratio or a very agitative mood spell, right? So when we will be talking about the mood disorders lately, we will be exploring the distinctive mood fluctuations and their possible reasons, their diagnostic features, and the pharmacological interventions regarding the mood disorders. Here comes another group of disorders that will be psychosis spectrum disorder. You can say the psychotic disorders. Basically, here we will be studying about what actually hallucination is, what are the delusions, and what are illusions sometimes. All right. And then we will be talking about certain kinds or certain group of disorders, including the schizophrenia, including the specific psychosis like hallucination. Sometimes the individual just present with the hallucination. It can be auditory, it can be visual, it can be tactile as well. So it depends. Then we will be talking about the medications of the psychotic spectrum disorder. That includes antipsychotic medications at a very broad spectrum. At the very early stage, when we have to talk about the antipsychotic medications, they were basically typical antipsychotics, and then it came to be atypical antipsychotics. So we will be talking about the management of the psychotic disorders lately. But you always have to understand one thing. When we are talking about the mood disorders or when we are talking about the psychotic disorders, basically their prime medication is very necessary for the individual, and you have actually a responsibility to make him understand the constellation of its medication. You have to make him persistent to take regularly all the doses as recommended as per the schedule. All right. So we will be talking about their treatment as well lately. So there are certain disorders in the DSM as per mentioned. Uh, they are basically related to the distorted body image, or you can say the anxiety regarding your body physique. All right. A person would be feeling like I'm having a very bad nose, or oh my God, I'm very heavyweight. But you will be feeling like, oh my God, that person is actually lying in the correct BMI. So that might be related to some kind of trigger. If a person is constantly behaving and constantly having a conscious response towards his or her body image, then you have to make it clear to them. So then it comes to unhealthy eating behaviors, as we all know. Currently, in our recent era, most of the females are very conscious about their diets, about their eating habits. Some of them used to term it as a dieting, and they are actually fasting themselves over 20 to 24 hours and sometimes 40 hours. So that is unhealthy for their lifestyle. But when it comes to unhealthy lifestyle, then it means that is certain kind of problem. And that certain kind of problem is sometimes stated as anorexia and sometimes as bulimia, where a person is actually bullying his own body with a very excessive amount of food in a very short time. And when he can't deal with that food very vigilantly, he would just spill it out and then again start taking it all the round the way back. All right. So multidisciplinary treatments are available for each kind of eating disorders, and we will be touching that group of disorders as well. So here comes another very broad and very sensitive group of disorders, that are the personality disorders. Basically, we wouldn't be exploring this group of disorders very much because first of all, it's very sensitive, and secondly, it can't be actually understand in just a one single lecture or one single course of like 1 month. So I will be launching another course in this regard. But basically, we when we are talking about the personality disorders, basically it's about the maladaptive personality traits. Personality is actually individuals' consistent patterns of behavior over the period of time around a particular stimulus. Whenever that stimulus came to his life, he will be responding approximately the same. Then it's a bunch of its trait. It's become, it's becoming its personality. That is not repairable. That is not moldable later in the late period of life. So um, that can be adaptive, that can be maladaptive. If a person is having a unhealthy personality traits, then it's maladaptive personality traits, and it sometimes can be very dangerous because it can lead to the personality disorders. So what actually is a recovery and what is a well-being? When we are talking about the well-being, or when we are talking about psychopathology, if a person is facing a psychopathology and due to your support, due to your care practices, due to your efforts in the resilience building in that particular person, like it's a journey. I acknowledge this thing. It's actually a very long journey, and you have to be there all the time with your patient, for your patient, each and every time whenever he needs your help, because he is actually having that bell-like continuum right now in his life that can be up and down. So when we are talking about the recovery well-being or recovery and well-being, we are basically emphasizing on our support system, on our care practices, and on our resilience building, right? So uh, if we develop this strategy, or if we develop this kind of planning for the treatment development for the psychopathology or for the patients with psychopathology, they can have a very good well-being. They can recover over a period of time. All right. So basically, that whole bunch of thing is not actually the maximum thing. This kind of psychopathology, the psychology, and entirely, if I'm talking about the psychology is basically a science of creativity. All right. And that requires long-term research, education, and compassionate care for addressing the psychopathology in any individual, because it's very sensitive to actually identify a psychopathology because of the stigmatization, because of the cultural belief, because of the sensitivity of this kind of issue that requires a very huge amount of sensitivity towards the patient, as well as your commitment towards the patient. All right. Um, we have talked about the diagnosis, we have talked about the group of disorders which we will be discussing and what are the basic spectrums of the disorders. We have talked about the importance of psychopathology and the identification of the psychopathology. Now we will be exploring the role of psychopharmacology in treating the psychopathology. As I mentioned earlier, your treatment management will always work in case of psychotherapy when your patient will be emotionally at that particular state that he will listen, he will understand what you are trying to say, right? He will perceive you correctly. He will be able to actually endorse your efforts, all right? When his neurotransmitters will be at that particular balance that he can understand you very well, at that particular moment, your psychotherapy will work, all right? So, um, here we will be exploring the role of the psychopharmacology and what are the impacts of those particular medications on the mental health and the effectiveness of psychopharmacology as well in case of different psychiatric disorders. All right. So, pharmacology is the study of how the medications are actually affecting the mood, behavior, and cognition. As I stated earlier, the whole pillar of the psychopharmacology or the whole pillar of psychology is actually based on the three, you can say, the substates. That is the mood, that is the behavior, and the cognition. Cognition is actually the thought pattern. So basically, when we're talking about the psychopharmacology, we are actually talking about psychotropic drugs, the drugs which are actually for the reason to treat the disturbances related to the mental health. All right. So, psychopharmacology is basically important for any clinical psychologist or the psychology student to understand the crucial role in addressing the complexities, or you can say that diversity of psychiatric disorders or disturbances. As I talked about the neurotransmitters and the medications, psychotropic medications actually target specific neurotransmitters. For example, as I mentioned about the schizophrenia, in case of schizophrenia, normally dopamine neurotransmitter is actually being compared in case of schizophrenia. So that will be targeted later in any kinds of psychotropic medication dealing with the schizophrenia, right? So basically, the psychotropic medication actually targets your particular neurotransmitter to regulate your behavior, your cognition, and mood, right? So we will be understanding the interplay between the neurotransmitters and medication, which is actually the crucial and important part to develop any kind of treatment strategy in case of any disorder. All right. So I think we are running out of time. You guys can rejoin me just around in 10 minutes. So let's just wind it up. So here comes the challenges and the consideration being a psychology practitioner or the psychiatrist as well, or a group of people have to deal with. Any kind of psychopharmacology actually presents certain side effects. Any medication have certain side effects. Any psychotropic medication have basically four things to deal with. First thing, you have to understand what is the efficacy of the medication a person is taking. Is the drug is very much effective over the period of time? Is it like a very instant reliever for the patient? Is the medication have a very good tolerance effect? All right. Then it comes to the state steady level effect. State steady level effect is actually, you can say that level of medication in your bloodstream where actually after a certain period of time your body has this much amount of medication that if you misses a dose, your medication, your previous medication can sustainably maintain the effect. So that is the state steady level effect. All right. So that depends on the carbon dating of your medicine basically. So when we are talking about the challenges, these are the few things you have to make it in consideration along with the dosage as well. So when we are talking about the challenges or the consideration as a clinical psychologist or as a group of psychology uh, practitioners, being psychiatrists, certain individuals have to understand that your medication's side effect, its tolerance, and its adherence in the body. All right. A patient have to adhere that medicine over the period of time. As I told you earlier, you actually have to work on the patient and you have to make him understand that that particular medication is necessary for the patient to take along the side all the way in every particular dose over the period of time, over a particular time, right? So that is called the adherence to the medication, stickiness to the schedule of that particular medication. So it is very important actually. And you have to understand one thing, that over the period of age, over the period of health, over the period of the body mechanism, an individual response to the medication can differ. All right. So the potential drug interactions are very important for us to understand. All right. When we become practitioner, you will understand one thing. Sometimes when we have a bipolar patient, all right, bipolar with a manic episode, and a person is taking haloperidol, or a person is actually having lithium, then over certain days, like 20 or 25 days, a patient will be like having a depressive episode, right? And you would be feeling like, oh my God, when he came here, he was presenting with a manic episode. He was actually having a bipolar episode, and right now he's having a depressive episode. How? That is basically the state steady level effect in the body. That is basically the drug interaction with the body, right? So now you have to maintain a different scenario of drug. Now you have to understand that the time to change the medication over the schedule has come. All right. So as we talked about the efficacy, efficacy of any kind of psychotropic medication is actually alleviating and improving the functions of the medication in the individual. All right. Basically, when we are talking about efficacy, we are actually demonstrating the role of medication and how much it is actually performing a role for alleviating, for compromising, and for improving the symptoms in the individual. All right. So, understanding the evidence-based usage of any kind of medication is very important, because every time it's all about the optimal level of the treatment. Optimal level of the medication will decide that either a person should continue the medication or a person should have another type of medication now. So here come another thing, that is the personalized medical approach. As I told you, the holistic approach. All right. So basically, in recent years, over the period of time, the advancements in the psychopharmacology have led to another approach that is called the personalized medicine approach. That is basically tailoring the individual's biological, genetic, and psychological factors. We are normally calling those factors as a P factor, right? As predisposing factor and perpetuating factor. So when we talk about a case and we actually identify those factors, we are able to understand that what kind of personalized medication approach will be effective. And obviously, the psychiatrist would consider to prescribe that particular bunch of medicine for them. All right. So this approach actually enhances the effectiveness of the treatment and obviously reduces the risk of adverse reactions or the allergies in case. As I talked about the emerging trends, then it includes the novel medication, precision medication, right? And the psychedelic assisted therapy. These are certain types of medication therapies that are recently been working in psychology right now. If we are talking about the ethical consideration, basically ethical consideration in case of professional or in case of psychologist we have to practice is basically we have to take the informed consent from the patient or from the second source of referral. All right. Second source of referral is the person that is actually referring that patient to you, that is actually taking that patient to you for the kind of treatment. All right. So then it comes to the confidentiality. That is basically you have to make sure that your uh, therapeutic intervention, the purpose of patient's visit to you, the reason of its visit, and the type of problem he is having, you can't discuss it with the person who can actually use it against that particular patient. All right. So then it comes to the equitable access to the medication. That basically means that at certain areas in the world, there are certain medications which are actually not accessible in that particular area. For example, I'm recently living in Pakistan, and in Pakistan, we normally have this kind of issues here. Like the patient would be coming to our psychiatrist, and they would be saying like, "Oh my God, we are not able enough to actually got this medicine, haloperidol, or we are not able enough to approach the medicine called the clozapine." So we will be actually understanding that this medicine is not accessible at this particular period of time. All right. So these are ethical considerations we have to practice. Okay. So we have to uphold those principles while administering any kind of psychiatric treatment or any kind of psychotherapy. All right. When we are talking about the future directions in case of psychopharmacology, right? Or when we are talking about the future of psychopharmacology, we are actually talking about um, the neuroscience or the integration of technology or the innovative therapy. For example, over the last almost past few years, there was no term including the hypnotherapy or NLP or the interpersonal therapy. Now there are bunch of therapies which are very different, or the timeline therapies. These are now the therapies that are being practiced separately. All right, guys, the time is up for this meeting. You can rejoin it. Thank you.